All right, we will first go through the scenario groups on the outer part of the graphic recording until we come to our vision in the middle, how the leadership role of Germany in global health security could look like in a couple of years. All right, and with that, I will do very strict timekeeping. Apologies for that already. The floor is yours.
Okay, so thank you. We first talk about cybersecurity and if it could be a cyber attack and cut all the supplies, focusing on vaccines, but we also talk about all the data that could be damaged. And we recognize that this is something that makes us very vulnerable, and we are vulnerable, and it's something that is going to occur. It's not if it is going or not, it is going to happen, and we think that maybe we are not as prepared as we think. So what we thought is that we need to start thinking and shifting our mindset into a crisis-based, not meaning that we need to be scared and all the time nervous about it, but yes, prepare. Thinking on making maybe some tests on what could happen if it happens. But we also talk about what are the knowledge that we have in Germany in general. We have a lot of enterprises and companies that work and already have ways of intervene and ways of being prepared, the resilience and a lot of plans to manage if there's a cyber attack. So maybe we can start working and making interactions with private and public and also academia to find out what is the best way of facing that. And second, what we say is that we have to have a crisis roadmap that is super clear so we understand what to do, when to do it, who are the responsibles, what is the roadmap that we should make, and what are the decision-making processes that we should take in order to, first of all, be prepared, then test it as much as we can in all the scenarios possible, and then, of course, be the leader, not only of cybersecurity inside Germany, but also showing that internationally we can be a bridge with other countries to keep it to more safety, but also trying to react in case or when this will happen. I think I took 2 minutes, so I can give it the word.
I will present for the second group. So we had the case of a malaria cluster in Germany, in the southwest of Germany in 2032. And we discuss what are the strengths, limitations, and what recommendation we could give. So first, we wanted to acknowledge the number of research institutions we have in Germany and the leadership that Germany could take on the topic with, of course, collaboration with countries like Ghana or other countries who have experience in malaria. The three main recommendations would be to emphasize on surveillance. So we need to survey to follow the vector, so the mosquito, Anopheles, Gambia in this case, and try to organize surveillance and monitor the vector. Then emphasize on research, because we have currently tests, bed nets, prevention measure, and treatment for malaria, but there are many resistance, so we need to have treatment and insecticides that work still in 2032, and work on vaccine maybe that are working better than the currently one that we have. We need to improve community awareness to inform people about the risk and how to live with this vector-borne disease. And the last point is to implement guidelines. We need clinicians to be informed and be able to have a better case detection, because they are not used to see a patient with fever and think of malaria and do a testing for these patients. Thank you.
Good. And I have the pleasure to present to you our thoughts on the case of a European heat crisis and which role Germany could play in that. We widened it a little bit and didn't want to focus too much on the European scene. But we had to acknowledge that, well, in the first area that we identified as a priority is improving infrastructure. There's still a long way for Germany to go. We didn't think that Germany's infrastructure right now is prepared for such a heat crisis. And well, if we just think 10 days back, I think we have all our experiences if we were at that point in Germany. So there are some short-term measures like the simple things, putting air conditioning in hospitals, in nursery places, in schools, offering these places also to vulnerable populations that are particularly at risk, but also the long-term infrastructure measures like planting trees, creating green spaces, creating water reservoirs near the places where people live. All this could prepare ourselves better and make us more resilient for a heat crisis. We believe that other countries are ahead of Germany there, also because they have more experiences with heat, but particularly in mind we have the case of France that take its lessons from the heat crisis about 20 years ago. Very much related to that is the case of heat plans. I mean, these two things go hand in hand. Once that the infrastructure is there, people need to be informed what to do and ideally ahead of time so that precautions can be taken before the heat hits. The plans may exist, but they also need to be communicated to populations. People need to know what to do in that case. And again, we think that other countries there are ahead of Germany, but in the European context, we have the opportunity to learn from them. And the third area that is not necessarily relevant in the moment or to provide relief in the moment of heat, but we should take advantage of these moments and remind people of the importance of investing in climate protection. So you see that they're making climate change a priority again. It tends to be get forgotten in winter times. While many people think, is it really so serious as this scientist wants us to tell us? So in these moments when temperatures are rising up, we need to enforce the message that we need to invest in mitigation now. And here, Germany is in a particularly strong position, as we believe, because of the credibility that Germany has in the international context. It is seen by many as a leader in the area of climate change mitigation, and Germany should play out these strong links on the international scene to enforce this message internationally, but also in the national context. Thank you very much.
All right, going clockwise, I will now talk about the recommendations we had for the austerity shock scenario, where we talked about in 2029, given more domestic austerity than we currently have, and Germany not being able to support the Global Fund, WHO, these kind of efforts as much. There's a cholera outbreak in South Asia, and how Germany can remain a credible partner in global health, even given financial constraints. So we really tried to talk about the non-financial tools that realistically Germany could use, and the main one that kept coming up was the scientific expertise we have aside from our budget, and how we can really provide scientific and logistical expertise and help in cooperations. That's mainly what's trying to be represented with the harnessing networks for low resource corporations, as in low financial resources, what can be done on the scientific side. There was a lot of discussion on whether Germany should have a louder role in these kind of partnerships, or whether the current role we have, where we are mostly appreciated for being a partner and being not necessarily hands-off, but trying to let our partners lead in the competences they have, sort of where we should fall in that scenario and how we can better communicate that to our partners in partner countries, what we are able to do, what we are able to help them with, but also to our own population. So that can include informing people about the cuts we will be needing to make early on and having a plan before the budget cuts realistically hit. I mean, we've seen the budget for next year, so I don't think the scenario is too out of mind. And also talking to our own population in Germany, why we are still spending money on global health, even in a domestically tense situation. And for both of these main priorities, it includes seeking new alliances. Who can we reach out to as new partners, maybe as new scientific partners? Who can we reach out to talk to our own population, to reach the people we currently aren't reaching, who don't quite understand why we meet here and talk about global health and why this is important to German people also. So it was really the main points of how to remain a credible partner and how to remain a credible government to the people we try to govern in Germany.
Good morning. I've got the pleasure to talk about the disinformation and misinformation topic. We were thinking about an AI-driven misinformation scenario in the coming years, which is pretty likely, I guess, given what we see in the vaccine space already today. 4 points from us. Number one is there is quite a lot of forward-looking analysis, what can be done, and also backward-looking analysis, what can be done going on internationally. For example, there is the International Health Information Integrity Alliance, where Germany could be a member and contribute towards these discussions. Other governments have been sharing their health information integrity strategies in that forum, for example. The second piece was also to then sort of work on quality information and improving quality information and communication. There are several initiatives going on in that space, standards being developed currently in Germany and internationally for trustworthy online health information, for example. The third piece is then to have people on the ground and to have trustworthy institutions to work with. So there were 3 ideas in that space. The one that got most traction was the one with real people, real nurses, real doctors on the ground in the Landkreise or counties in Germany. But there were also other ideas who didn't make it on this page here regarding working with influencer networks or working with media sort of in advance of such a scenario to then raise the quality standard of communication there. And the fourth and final point is to work with youth and to include youth in the preparation, for example, via youth delegates or youth advocates or youth advisory networks. Thank you very much.
Yes, finally, thank you. We did a round of all the moderators and we're thinking about what is the outcome of all those different scenarios. And what we found out is that we have quite very capable institutions, we have very capable regulation, research labs on all those scenarios here in Germany, and that's a good message. On the other hand, we can see, or we found out, that all those infrastructures are quite vulnerable. The whole system is not made, I mean, it's made for peace times, but it's not made for times of hybrid threats, of sabotage, of disinformation, all those attacks that we are facing at the moment. And this brings us, or brought us, to the final and very important questions. What do we have to do, or what can Germany do? What is the role of Germany to change the situation, or to confront, or to face the situation? And there we found quite a few points to the role. We called it the broker Germany. That means the kind of a fair broker or a bridge builder who has the power to be the intermediary between different countries, to put into the experiences of other countries into the dialogue, but also integrate the private sector, which has quite good experiences in tackle resilience globally, and to put all those together, but not just for the sake of putting them together, This is what has been done maybe in the past quite well already. But in order to create an impact, and the impact of this broker role we have put on this wonderful picture as well. We found very important that they are creating, or we are creating, playbooks, like kind of a stress test playbook. So what are we doing in kind of cross-sectoral thinking when the case happens? Like, this information is nothing where you can prepare like a couple of weeks, but this happens on one day to another. And are we prepared to confront this situation? And this is something that you need to do on a global stage. So this is why the role of Germany in the WHO must be massively expanded, or at least expanded to that kind that the voice can be heard, not as a single leader, of course, but as a broker who brings the voices together. Maybe some new aspects that we found out then later was some details like the digital sovereignty we found quite important in terms of disinformation, but also in terms of our dependencies on IT infrastructure, because the reality is that we are depending on one country in the world that may stop the IT if they want to. It's just a theoretical possibility, but it can be done. So it's maybe not too theoretically. And we have to tackle all those problems. Let me maybe finish with the self-understanding of this role, because it has been emphasized so much, the trusted, humble partner. So we are a partner who is a partner, but also has his mission. So this is maybe a kind of a role that we need to learn, to train. And finally, we hope that we can create a leverage, Hebel, yeah, to create an impact. And if we do all that, and I think the people from the ministry are here, then we can tackle the situation and the challenges that we are facing.
Thank you so much, everyone. This was amazing. You did a great job. I didn't have to show my 1-minute sign at all. So thank you so much. Again, a round of applause, please, again, for our moderators. Thank you. So they had the very difficult task to put together what has been developed yesterday in 60 minutes, in 3 minutes. And finally, you heard the vision of a leader, Germany as a leader in global health, security in the middle, and then particular recommendations around. But now we are very curious to hear what our government has to say to that, because they are the ones who actually have to work with the recommendations. And therefore, I would like to invite on stage, first of all, Paul Zubeil, Deputy Director General for European and International Health Policy. Please join me here on stage. Thank you. Yeah, in the middle. Perfect. And then I would also like to invite on stage Dr. Kirsten Kappert-Gonther, member of the German Bundestag and steering committee member at the Global Health Hub Germany. Please join me on stage. We are looking forward to your discussion. The floor is yours.
Well, first of all, thank you, Dr. Kappert-Gonther, Member of Parliament. I'm very pleased you're here today, and from the recommendations that we've just heard. So what is your initial takeaway from a parliamentary focus? Where do you see the strongest connection in this area that was just presented?
Here again. So I'm very, very pleased to be here. Thank you for inviting me. And my very first impression is, wow, thank you. Let's take all of this and bring it to the floor of the German parliament and the German government, because those things are key and would make the world better, not only in a global health perspective, but also on a national level. So I'm absolutely thrilled of your work. And this is maybe like a nice thing to say, but I wouldn't say it if it wasn't true. And it's true. You did a great job. Thank you.
Thank you, Kirsten, for your initial remarks. Now, just reflecting a little bit on what we've just seen and heard on the recommendations, where do you see the biggest challenges ahead?
There are multiple challenges. Of course, one is the cuts of the funding. I think the underlining biggest challenge for mankind is climate crisis, and that you pointed that out, that we do have to do more about the heat protection, but also combine it with really fighting climate change. I think this is absolutely grounding the work of everybody. And what really strongly resonated with me was your thoughts about the role Germany should play within the global health context. And I really like the idea of being a leader within, like, connecting with the experience and the needs of other countries, not only the global north, but especially the global south, but being a leader in commitment. Not only sitting on the table, but sitting there saying, yes, Germany is strongly committed to the work of WHO and within global health. I think this is a role that Germany should even take more serious and more strongly as we see it right now. And this is, Paul, if I just may, this is not about dominating other countries and other thoughts. This is just about commitment, right?
Thank you, Kirsten. I'm very pleased you're saying this, and also that this is not about domination. It's really about giving orientation, but also using leadership as orientation. And I couldn't agree more on what you just said. Now,
pleased to hear that, Paul.
Sorry?
Good.
Yeah. Global crises also influence the state of mental health of people. And I know you're very tight in time, so I would really like to raise 2 points before we need to let you go. And one issue is, so can you elaborate a little bit on what that means, also how this influences mental health and what we could do about this? And then I have a second question on the rights-based approach as well.
Thank you so much for this question. When I met Dr. Tedros a couple of weeks ago, he said first, hello, Kirsten, and then he said, I remember mental health is key. And I said, yes, Dr. Tedros. And I liked that little conversation. And being a psychiatrist by training, working in this field, in the clinical area for 20 years before becoming a member of federal parliament, I really strongly not only believe but know that this mental health pandemic we are seeing throughout the world right now on a global level really affects not only the individuals with all their needs, but it also affects the way how societies are built or get more unstable. And on the bottom line, it's a matter of democracy if we really focus on the needs of mentally ill or people who are in a mentally crisis. And if we take the connection from what is the climate crisis doing to our souls, there's a huge connection and we tend to forget it. We know people are dying because of the heat, but we don't know or tend to forget that there is an increase of depression, of anxiety disorders, that all those weather effects on flooding, houses are destroyed, everything, of course, how do you say it? People get PTSD from those effects on climate crisis on their personal lives. So if we really want to strengthen not only the health of people globally, but also our democracies worldwide. We have to focus those mental health issues, and this is why I'm so absolutely committed to the WHO idea of MHPSS, which is not only the key for pandemic or other crisis preparedness. I think it's the key MHPSS for how we build our health care system.
Well, thank you, Kirsten, and 100% fully agree. But the $1 million question here is, for me, how can we integrate this actually in the global health agenda, in Germany's global health agenda? So do you see any concrete opportunities where we could integrate this?
Yeah, I do see two concrete ideas. First is talk about it. Don't forget mental health. Secondly, do an MHPSS, how do you say it? We talked about it before. Like a simulation, right? Danke, Veronika. So I think we should do that in Germany because, and we should fund it from wherever, but I think if we would train partners on what MHPSS really could, what the gain for the people would be, we would understand that this will initially cost a little bit of money, but it will save not only lives and and support well-being, but it really would save money on the long run.
Oh, thank you very much. On the funding issue, I'll ask the Commission later to fix it for me. We do this by last.
No pressure, Paul, but would be great.
Now, so last point I would like to address, and that's really a point that's close to my heart and to your heart as well, I know. It's about the rollbacks of women's rights, and especially for women's health. So what can Germany do, especially in sexual and reproductive health rights for women, what can we do to step up our efforts, actually integrate it in policies, and how can we make sure that sexual and reproductive health and rights are not falling through the cracks?
First of all, acknowledge thank you for this question, really great. Acknowledge what's going on in the world. And we do have a worldwide alliance to threaten women's rights and women's reproductive rights, and that is women's health. So acknowledge what's going on. We know on a UN level, for example, we always have to identify if you really want to open some points to push forward to gain more women's rights, or if we just leave it on the level we have right now, so we don't have the threat that there will be like a decline on what on the UN level is said to women's rights. And here again, it's not only about the individual women. It's not only about the individual family. This, of course, is absolutely crucial. My body, my choice. This should be like the idea everywhere. But also, if we do threaten women's rights and we do threaten reproductive rights of women, again, it will make societies more unstable, and it will be a threat to democracies worldwide. So if we, as Germany, really, if we sit on the table, have a strong commitment, even more leadership in terms of commitment, address those issues and say, no, we in Germany stand for women's rights. And if I may include, it should be on the national level as well. There's some way to go. We still have abortion rights under threat in Germany, and it's still illegal, which shouldn't stay that any longer.
Thank you very much, Kirsten. I really think that in all these discussions, also men need to play a crucial role in support of sexual and reproductive health and rights of women. Now, we do face a rollback on the political front, on the political declaration front. Last week in New York, for instance, when the high-level meeting on HIV, if you look at the OECD, for instance, and the Health Committee, the questions we always pose ourselves, and I pose myself personally as well, is what do we do? Do we go a step further and advocate for more rights, or do we maintain what we've actually achieved? Because there's a side to both coins, right? If you open it, you can even fall back beyond what was actually already achieved. And so in some occasions, it could be actually smarter to maintain what we have because we know there's nothing to be won. So that's not a one-size-fits-all. It really depends on the situation. But I fully concur with you that we need to actually keep this on the political agenda also, not only internationally, but also nationally, because it needs the national drive to also become visible internationally. Now, Kirsten, I know that a crucial vote is waiting for you at the Bundestag right now. So I would like to sincerely thank Dr. Kirsten Kappert-Gonther for her interventions, for her remarks, for your food for thoughts that we'll use in this discussion. And I would like you to have a big round of applause before you leave. Thank you, Kirsten.
Thank you. Thank you for not only the timekeeping, but for your work. It's so helpful for all of us to continue our work in the parliament and the government. So thank you again and hope to see you soon.
Now, thank you that Kirsten has set the stage. I'm very happy that we can broaden a little bit the perspective, and I'm very delighted to invite a round of international experts to share their insights on these recommendations and offer also their views on Germany's engagement and role in global health. So let me start by introducing Dr. Revathi Falki, Director of the United Nations University International Institute for Global Health. Dr. Falki, you bring a strategic UN perspective on translating global health evidence into policy to the panel. Please join me here on the stage. Welcome. Thank you. Second, let me introduce Dr. Francisco Pérez Cañado, or just as everybody calls him, Paco. Please come to the stage. You're the advisor of Sandra Gallina, the Director General of DG SANTE. Welcome, Paco. Good to see you. And we are delighted to have you with us today. Now, I would also like to welcome Dr. Uni Karunakara. He's not only the former president of the Médecins Sans Frontières. Welcome. Good to see you. But you're also currently spending the right time here in Berlin to conduct research on Germany's global health role. And how fortunate for us is it that you're here with us today. Welcome, and thank you very much. Now, yesterday, we've already set the stage on the Germany's role in global health. You've worked a lot on different scenarios. We have a number of 5 recommendations coming out of this meetings yesterday, and what really struck me was also the illustration that you made yesterday, I think, and that was now alluded to and described actually in words what that meant. I read it this morning as well. Here is the picture. I think it very clearly shows where we are headed, and therefore I would also like to start a question with a practitioner in this field, and that is Dr. Falki. You have over 20 years of experience in implementation research around the globe. So which of the recommendations we've heard resonate most with you in practical needs? What have you witnessed around the world? And maybe you can share some of your experience, how they align to the recommendations and the issues we've identified yesterday and this morning.
So first of all, thank you very much for this kind invitation. And I would just say a few words about my organization, because I think not everybody knows the United Nations University. We are the academic arm of the UN with a triple mandate. One is to work with academic institutions and people who hold evidence, to synthesize that together with them, bring it into policy spaces. That's the second mandate. And the third mandate is, of course, capacity strengthening. So from that position, I will try to link it, also to some of the experiences I've made. I would like to congratulate all the teams for the wonderful graphic, but also the summary. I attended just one of the 5, and I think it was really inspiring to see, how the discussions evolved, because thinking about the future is not something that comes naturally. And, foresight skills is something that is very, very critical for, everything that we discussed here, and the interdependence and all of that. But I'll name a few that resonated the best with me. The first was, of course, the leveraging of political influence to kind of advance some of the global health concerns that we have identified. And that also resonates with some of the leadership challenges that we have seen, the vacuum that has been created in the last couple of, maybe a year or 18 months, but also how we're going to navigate that space. The second one, and which is very close to my heart, of course, is the climate action one. Last 10, 15 years I've spent looking into the climate emergency points. So, reprioritizing that. I think it's something that is there, is talked a lot about, that it moves to the back burner when something more urgent comes. But this is something that we really, really need to prioritize. And I think there is increasing momentum in the last 5 years with public health practitioners making the necessary noise and the visibility in the climate policy spaces and practice spaces, how important and critical this is for just the existence of the planet, the people, and also peace. So I also like the last point that was made in the first session. Intergenerational input into policy. So previous to this role, I served as the Global Director for Save the Children. And I mean, with almost 2.2 billion children and adolescents in this world, this is an absolute priority. That, not just tokenistic inclusion of this population group, but really meaningful inclusion of their concerns in terms of how their health is being kind of, characterized and decided for the future. Solution orientation. I think, that was also another theme that came out quite strongly, that moving away from problem characterization and really looking at what are the solutions that are available to us, but also all of these issues that you see on the screen necessitate cross-sectoral approaches. So that was another thing that increasingly I have seen, at the community level, at the policy making, the practice level. How do you integrate all of that? It doesn't matter whether it's a climate policy or a health policy or, any of the other distinctions that we make. All of this culminates at the subnational level. So how do we, bring that thing? And then the 2 last points that really stood out for me was the humility to learn from those who know. So, that reverse of feedback loops that we are increasingly seeing sharpened, funded, and scaled up. And today I have deliberately decided to take a very positive approach to answering my questions. So you will hear me really highlighting the strengths and, of course, some of the challenges that we see. And we recently also hosted the Global Health Security Conference in Kuala Lumpur last month with almost 1,300 people from over 84 countries. One message that came out of that 3-day convening was the importance of trust, transparency, and communication. And so this is something, that navigates so many aspects of global health, that pick any, and these 3 things really stand out very, very strongly. So I'll stop there in terms of, saying, what really stands out, and also how do we prioritize? How do we take this into action rather than, it staying here as a graphic? Thank you.
Thank you very much, Dr. Falkin. Just maybe a follow-up question, because that's really interesting. And from the priorities you just described and that were identified, in your view, how do you think that those priorities really align also with Germany's global health agenda and the Germany's global health strategy or the EU's global health strategy? Where do you see the fits and where do you see the gaps?
So I think if we look around, the circumstances that we are operating at, the geopolitical fragmentation that has really come to the fore, the shrinking fiscal spaces, also the democratic spaces that we have seen, civil society organizations are increasingly, they have to fight to keep the space, not even talking about expansion, and of course the environmental degradation. So if you look at all of these things that are happening around, I personally believe that Germany's global health policy and strategy, as described in its original form, and also with the review that came in recently, and then the 8 priorities that were identified from there. My personal opinion is that, of course, it aligns in the diplomatic ambition that it sets out. But I think the bureaucratic operationalization of this, both within Germany, when you talk about the interministerial cooperation for everything that we spoke about, requires some attention still. And also in terms of how do you then take it outside, right? Like how do you take the discussions happening within Germany? And this is a very vibrant space. I was part of this almost 20 years ago because I studied here in Berlin. But I do see that fundamental shift in how we're talking about global health, the expansion beyond pockets of global health work that was happening in Germany in the science spaces. Moving from biomedical, the strength, of course, and that was another thing that was highlighted here, the strength of biomedical sciences in Germany, and then expansion of that into the implementation science spaces, because that is where we operate the most, and that is where we need the most kind of policy to practice interfaces that need to go. In terms of some of the examples, where you see that the alignment is truly there, and again taking a positive approach to this, given the profound uncertainties that we are operating in, the 2 areas that Germany has demonstrated leadership, and again we heard that also from the ministry representative in the session before, was support to the technical leadership. So support to the WHO, we've seen that, in the previous phase. Yes, you can always do better. Yes, there is always more. And it's a relative assessment, right? Like where we were, where we want to go, and what we are doing now. The pandemic hub, which is hosted here in Berlin. So you do see that steadfast commitment to multilateralism. We are going through the UNAT process at the moment, so it's really nice to see. And also the comment that, was it Kirsten made about vocalizing, increasing our commitment to SRHR. Coming from, that work profile with Save the Children before, and the backlash that we are seeing in the last year on gender, on women's rights, that was quite refreshing to hear that, okay, we need to do more, not just in Germany, but also outside. And there are very little spaces right now where you can talk about this as a priority and also set ambition for increasing work in this area globally. So I really commend and congratulate, that thinking, that space is still retained. And then the operational bilateralism. So Germany has traditionally taken a very system-based approach. You also see the climate discussions that have happened. They're also in the One Health space. They are, yes, you do both. You look at the vertical disease control things through your funding through Global Fund, the Green Climate Fund work that, you sit on boards of many of these financing facilities. And this is where the main bottlenecks are right now. When you look at global health action, the scale ambition for global health, these are some of the bottlenecks. So you do have that diplomatic space to influence, how work is being done. And I'll probably end with 3 misalignments, I would say, not misalignments, but, areas of improvement, I would say, is that commercial or industrial ambitions of Germany, unlike any other country, compared to the health equity, global health equity discussions. We saw that during COVID-19. We see that, now with the PABs and the pandemic agreement discussions. So it's not unique to Germany, but those discussions have to be taken. Interministerial coherence. So I navigate the academic, practice, and policy spaces. So again, not unique to Germany, but how do you bring that interministerial coherence when you're setting that diplomatic ambition for where global health needs to go and how we are going to support it? And I'll end with saying that the costs of inaction in many of these areas have escalated so much that the gap is always going to be very big. So the further we can go, the more we can push, the better we can optimize the work that we are doing across what we see on the screen is probably going to be the way forward. Thank you.
Thank you very much, Dr. Falki, for your very insightful and really inspiring thoughts and remarks. And now let me turn to Paco and to see whether this assessment that we just heard, is that also your perception, or where do you see the Commission's expectations for Germany, actually in its strategic priorities in global health? Where would you see the main issues?
Thanks a lot, Paul. Thank you very much. Es ist immer ein Vergnügen, hier in Berlin zu sein. Ich bin mehr oder weniger zu Hause hier, aber das ist eine ganz andere Geschichte. So, it's a pleasure to be here with you. Many thanks for this event. I am impressed at this reflection process because, in a sense, this is a global health event, right? But most of the issues that you guys have been discussing yesterday have actually to do with the impact of health in our internal setting. And this shows that the way that we treat global health has fundamentally changed. Yeah, and now, and I don't think ever before, the decisions that we take in global health are going to have a fundamental impact, not only in our external policy, but also in our internal policy, and even in the resilience and in the stability of our societies and economies. And in this perspective, that the EU, thanks to German leadership, came out with one of the many tools that we have created for member states as part of the European Health Union, the EU Global Health Strategy, 4 years ago now. And we've done a little bit of a revision just a few weeks ago with the Global Health Resilience Initiative. And this is where I want to link in to many of the points that you have made. The underlying issue here that underpins all of your discussions is that in many, many countries in the world, we have seen, because of the geopolitical politicization, does that work? And the geo-economic, influence, global health has been, shall we say, significantly affected. We have a significant also decrease in the financing streams. So two fundamental gaps have emerged. Gaps in the resilience of health systems. Some of the examples are there in your discussions, but also gaps in global health security networks. So the Global Health Resilience Initiative, what it attempts to do, following indeed, as I was saying, I think many of the German ideas, is to fill those gaps. Now, picking on some of the points that have been made before, how do we do this? We are confronted with geopolitical competition. We are not about imposing on others, but we have very strong examples in our very diverse, efficient, cost-effective, innovative health systems to share with partners. So a fundamental aspect that we want to focus on is to give the EU offer, including what the German health system has to offer in all of these solutions. That's point number one. Point number two, we're suggesting also to focus and picking up on the very important points of surveillance made in the case of malaria, but to generalize it, we are witnessing fundamental gaps in the global health security networks that underpin the global health security and our protection against pandemics. And we have to focus, and this is our approach, our suggestion, we have to focus on filling those gaps. That is a second fundamental element. Let me jump to a third element which underpins this whole discussion, and that is what should be the role of Germany and the role of the EU in the system. We have to be self-critical. We, as the European Union, the European Commission plus member states, we hold a fundamental influence on every single international institution, whether it is the WHO or global health initiatives, Pandemic Fund, Global Fund, Gavi, you name it. Our suggestion in the Global Health Resilience Initiative is to work closer together so that we take decisions now for each of those global health initiatives and in the WHO in order to shore up these resilience gaps. And we have to move in that sense, and it is a little bit provocative, but we have to move from this teleological discussion on global health architecture. What should it be? We are already sitting in those boards. Yeah, a good example is the Pandemic Fund, where I think that the Team Europe, so the EU and its member states, are working closer together than ever. And in a relatively new institution, we have been able to raise raised $11.5 billion in less than 3 years of operation to shore up prevention and preparedness gaps, also in the One Health space that is often forgotten by so many, which has been a record, and in a way that is inclusive of our partners, where there is no donor and recipient, but rather investor and co-investor, and where we have, at the end of the day, country ownership, which is a fundamental factor. So, in the European Union, we're very happy thanks to the German leadership and the ideas fed into the system, to work together with Germany and all member states in order to shore up these resilience gaps that have been highlighted, and many others as well. But at the end of the day, we can start doing this already today. And that is the big question I leave to all of you. I'm also very happy that we are quite often in the Bundestag making these points, because at the end of the day, this is what we need to do. We need to act together now, and that will shore up. And Paul is going to kill me now because I've probably gone over time already, but so be it. You've mentioned financing, elephant in the room. But if we are able to work together in a much closer fashion between European Commission, other EU institutions and member states, we are going to be able to achieve significant synergies and much more impact for our common goals, even with a lower financial input. And that is precisely what we're seeking also to do. So a little bit of homework for everybody, and a little bit of homework also for you when you seek contact with your national institutions, with your parliamentarians, but also with the European Commission, to keep reminding us of that and pushing in that direction. Thank you.
Thank you, Paco. You know that I'm always particularly generous when it comes to time with you. But now, on the priorities you just identified in the resilience gaps, let me ask you one very quick follow-up question out of personal interest. So, when you talk about this, what needs to be done, what role has the EU and also member states in advancing those priorities, and what are the concrete actions that we can take from now on actually to advance those priorities?
So let me give you one example in each of the 2 or 3 areas I've mentioned before. First of all, in terms of our engagement with third country partners, Germany, sorry, I'm giving you homework a little bit, but that's okay. And also BMZ, the excellent colleagues from BMZ. So when we seek contact with partners henceforth, we're going to be underlining the whole spectrum of solutions that European health systems can offer. Let me give you one stupid example. The next wave that is going to hit our developing country partners is NCDs. Non-communicable diseases. This is going to have this will be a bomb. We have a lot to share in terms of those solutions. So come to us. We work together with partners always in a Team Europe approach. So come to us so that when we make an offer to partners, we'll be offering them solutions which will also integrate the solutions that our private sector can bring, which has been mentioned also by many of you, and that is very important. This is in the area of filling resilience gaps in health systems. In the area of filling the gaps in the global health security networks, I'm going to pick on another one of the issues that has been mentioned here. It's not only about, we know that the WHO managed networks, both in terms of preparedness, prevention, and response, have accumulated a number of gaps in the past 2 years. We need to prioritize financial contributions to those areas, point number one. And point number two, we have to support with expertise, all the work that the WHO is doing. And this is something that we can do certainly together. So, and it's something that is also foreseen in the Global Health Resilience Initiative.
Thank you, Paco, and that's a good actually point that you're talking about expertise. There, I would like to turn to Dr. Karunakara, who brings a massive amount of expertise in the humanitarian sector, and you currently are examining Germany's role in global health. And I would like to know what are the first outcomes of this work, and how do you see how these priorities that you've just heard, how do they match with the work that you're just carrying out in examining the Germany's global health strategy and policy?
Thank you, Paul. First of all, I want to thank the Global Health Hub for inviting me to join this panel. So my work is ongoing, and so far I have spoken to quite a few members of the civil society. I've spoken to several academics. I've spoken to journalists in Germany and also in Geneva. And I'm yet to speak to government officials. So I will be asking to speak with you at some point. So I'm looking at the policies that have been stated, but also what has been done so far in terms of conduct, in terms of orientation, etc. Now, just going back a little bit to what was discussed by the Future Lab yesterday and the 5 scenarios. So one thing that comes very clearly from these scenarios is that like all of the 5 discussion has been posed as a threat to Germany, right? And each of these threats come from outside. Now, what we realize, or we have to realize, it's not Germany and global health. The global is in Germany, right? There is no wall between Germany and the global, right? So it's not just in perceived threats. It's also in Germany's response. If you look at supply chains, medicines, active pharmaceutical ingredients come from China and from India. If you look at the workforce, nurses come from the Philippines, doctors come from Syria, right? So we have to start thinking of Germany as part of being global and not just something separate. And that probably goes for Europe as well in a big way, right? So it's also the vectors. The vectors, you can stop people in Frankfurt, but, the vectors and also the heat, we're talking about the heat crisis, also doesn't stop at the border. So all of this requires us to think of coexistence. And I think the scenarios, I think all of you, the Future Lab recommendations actually do bring that point together, that we have to think of problems collectively. Now, as far as the research is concerned, Germany's approach to global health, or Germany's commitment to global health, very often is still, at least in the public sphere, is seen as charity. It's something that you give to people in other countries. It's seen as aid, it's seen as charity, and it's something that Germany does for other people, but it's not seen as something that we do for all of us. And that comes across, and that is important, especially with the political changes that could happen in the next. We have to form a narrative that doesn't put us against them, and it has to be. We have to think of different ways of communicating this charity framing of global health work that we do. Right now. Looking at some of the points, first is there's a lot of talk about leadership, right? And so I think what the Future Lab has talked about, the willingness to learn from countries with long experience of heat, vector-borne disease, etc. So not just Germany as a leader, teaching others, but also that willingness to learn. I think that was a very important thing, and this is a right shift. We're in the land of Robert Koch, where bacteriology, everything. So there was a lot that Germany has given to the world, but the experience with those diseases, etc., are now in other parts of the world. And when it comes to Germany, we also have to learn. Now, leadership. This is something that I heard across the board from a lot of people I spoke to, that the very biomedical approach of Germany to global health. Now, one person told me, yes, it makes sense because biomedical approach is apolitical, right? So that makes sense that Germany makes this approach. It takes this way of dealing with global health. But leadership also involves dealing with governance. And I think there were talks about honest broker. Someone mentioned that. Fair broker, I think, was the term that was used. And then someone talked about a humble partner. So these are all elements that go into, if we want to rethink leadership, these have to be essential elements of it. Then communication and trust. Trust comes up again and again. And I think in your feedback from the Global Health Security Conference as well, trust came up. So all of this needs to be really bought in. Now, again, the point that I made earlier, because German public sees aid, the German financing of global overseas development assistance as charity, and it's something that is very vulnerable to change in priorities and also budget tightening. So what is charity will be cut first. So we have to frame the narrative that global health is not just generosity abroad, it's also protection at home, right? I'll stop here for now. There are a few more points, but we'll have it in the discussion later.
Thank you very much, and there will always be a second round where we can ask those questions. Now, let me briefly reflect on your interventions or comments made before I give the floor again to Dr. Falki. Now, on the argument that you mentioned, the charity argument, yes, that holds true for the past, although I see now, at least in Germany, that this argument is luckily slowly fading. There are discussions ongoing that an investment in global health is also an investment in national security. So the security angle for the national security is slowly but gradually actually evolving, and that's a good thing. So we're turning a little bit away from this charity argument in Germany, which is also very necessary, because if we can't drive this narrative away from the charity argument, then we will have less and less financial means that we can also then justify in front of our populations and our constituencies. Yeah. So it's important to say what is the national interest in investing in global health as well. So I think I see a bit of a light at the end of the tunnel, which is good. Now on the leadership, on the second point that you made on the leadership, yes, Germany has evolved over the years as a leader, but mainly as a leader in financing. So we are not there yet where Germany really sits at the table where decisions are made. There's technical experience, but if you look at the landscape, Germany is not in international organizations there where it should be, according to its share, and also according to defending multilateral structures and take a responsible role in transforming also the global health architecture. So that is something that we need to work on. Nobody expects more money of Germany, I guess, but the world expects more engagement. And that engagement needs to happen where decisions are made.
I want to underline that because at least two people I spoke to in Geneva said that Germany thinks money is leadership. Right, yeah. And so that narrative that has to change, how Germany operates, and there again you see a distinction between how Germany approaches global health versus how France approaches and how Spain approaches global health. So that's something that needs to be taken seriously. Absolutely. Money in itself is not enough.
Money in itself is no leadership. No, that's actually, well, it comes with leadership, right? But it should not be the other way around. But we'll talk about this a little bit later. Thank you so much for your remarks. Now, the discussions about Germany and the EU in global health are obviously inseparable from the transformation role and the partnership role that we have with the Global South. We need to talk about this. So what are your thinking about the evolving global health architectures? What are the questions that we need to ask now to really build a sustainable global health architecture, and also for the next generation, a global health partnership that really sustains?
Yeah, so thank you very much. So this wasn't an easy question to answer. We see so many of these discussions happening, at the regional level, the Welcome initiative which happened, the 5 things, and then they brought it together. We ourselves convened a regional dialogue in Delhi. We followed it up with national conversations in the Philippines, in Vietnam. We're hosting the next one in Malaysia on the 27th, Indonesia. One theme that really comes up from all of this is the importance of decentralizing these decision making, the proximity of where the decisions are made. And I would be a little bit bold and say that yes, money is not leadership, but it would be naive to say that we don't need more money. We probably need. There are resources. I wouldn't say that that's the only thing that we need. There are resources, but the optimization of those resources, I think, is the key challenge, and that is another thing. So the governance conversations that are that are needed, but alongside that, the financing mechanisms and the operationalization of those governance structures is something that comes out quite strongly through all of these conversations. Now, I myself have sat through so many of these partnerships discussions, as not just at UNU, but even previously, where most of the agenda setting is done by the North. So you see there is representation, but I don't know to what extent inclusion of those recommendations really is reflected. And I wouldn't say that all of it is bad, but more needs to be done in terms of, how the agenda setting is being done, where the corridors of power are, are this like these clusters of, Geneva and, New York, and now increasingly we are seeing Bangkok from our regional thing. But also, how do we optimize existing structures? So we are focusing a lot more on the ASEAN now. Now, ASEAN is not a space traditionally for health, so it is more kind of, commercial interest. But speaking to your point, Paul, framing global health discussions through the health security is gaining traction in the regional discussions and entities as well. So some of the things, I think this is now, as we step into this new era of, reconvening, constellations being formed, constellations being dismantled, it is an opportunity to reset some of the traditional thinking that we have taken in terms of partnerships. And some of the questions that stood out for me, the first is, again, who sets the agenda? The second is who is at the table. And this came out in both the panels yesterday as well, right? Like not just having tokenistic participation or representation, but inclusion of those recommendations in what comes out in terms of, the decision making that is being. The first step to all of this is also accepting that we have been the architects of this asymmetries that we have created. And in many ways, we have fueled the consistency in which these have sustained, the asymmetries in power, the asymmetries in the negotiations that happen, whether it's in the climate space, whether it's in the health space, whether it's in the health security space. We have kind of, been contributors to this. And that's where the point that was made in the graphic as well, the humility to cede power. I think this is something that, at various levels, this needs to happen, whether it's, engaging with the civil society organizations, whether it's taking the intergenerational approach in kind of, resetting some of the power equations there, whether it's the regional entities, whether it's the global entities, and so on and so forth. So finding out who is missing from this conversation. And then the ownership. All of this reflects in the ownership discussion, that owning not just the processes, but also owning the outputs of it in terms of, how we are engaging. How will these new partnerships then navigate the geopolitical situation, evolving geopolitical situation, is something that we need to think about now. Because that, we see a lot of now patterns of coalitions of the willing. If consensus is not reached in global negotiations, then you see clusters of, member states or organizations forming their own thing. But I am still not, until the dust settles, I think it will be unclear whether we had more fragmentation before or we are actually having, a different set of fragmentation now. So I think those are some of the things. And then the last point I will say about the new sets of partnerships is the exit strategy. So, are we designing the local, if you keep the localization agenda in mind, then we do need to think about our own dissolution when we are engaging in these spaces, but having that clear sunset clauses in how we are engaging in global health work, that we do it responsibly and sustainably and hand it over, in more graceful ways than we have.
thank you very much, Dr. Falke, for your remarks, and I agree, especially also what you said on the sun setting, and we just had discussions in New York with regards to UNAIDS on that, for instance, but also what you say, we have to basically see the exit strategy, and there we also need to talk about national ownership and domestic financing for sure. But now, let me go a little bit off script, because this is a discussion that really evolves, and I know that Paco wants to react, so I would put the other questions that we still have in the parking lot, and if you still have time, then we tackle those. If not, we do this bilaterally or in the group discussion. But that's too important to not actually let this discussion happen. Paco, please.
And thanks, Paul, for this sort of rebounding that we discussed about in the preparation that is so interesting. Global health architecture and this whole discussion. A couple of thoughts from my side. First, a little bit of background. What is actually going on when we are having global health discussions? Let me give you the example of the HIV resolution that we have, the HIV high-level meeting, which has led to a political declaration just a few days ago in New York. This has actually gone back on the human rights front. It's much less ambitious than before, and it even does not sit well with some of the fundamental human rights standards that we hold in the EU. There is language there also that supports the sanctions-based approach that parties like Russia push. And on top of that, it crosses a number of other red lines concerning intellectual property, financing, et cetera, from the point of view of the EU. So are we witnessing, and this is a provocative question, are we witnessing in the multilateral sphere a new kind of asymmetry with, shall we say, unilateral, I wouldn't say imposition, but I'll just throw the word out for good measure, unilateral imposition of ideas from, on the one side, the fragmentationist views of some individual partners. I will not name the partners, but you know who I'm speaking about. And on the other hand, the views of, for example, in this case, many developing countries, which are being imposed, breaking away from the principle of consensus, which is breaking away from multilateralism. That is what we're seeing today, a new kind of asymmetry that is emerging. So what we want to do is to make sure that when we are discussing global health architecture and these important issues, that we keep this in mind. The landscape has shifted tremendously. That's one point. The second point, very important, country ownership. Ownership is so fundamental. At the end of the day, all of these global health architecture discussions, we have to break away from the cycle of aid dependency. And we have to be clear about this. This has existed. Yeah? Now we have the opportunity, because of the cuts in financing, to take that step, because our partners are asking for more opportunities to have and to really grasp their own health sovereignty, both in terms of their policy decision-making, but also in terms of them taking responsibility, primary responsibility for financing health systems. This will be a progressive issue. And this is another big issue that we have to tackle here. And this is at the heart of how we see things, supporting that transition to health sovereignty. And finally, the other elephant in the room, we need a global health architecture where each organization focuses on its core mandate. And competition is good, always, between global health initiatives, etc. But we have to stop, because of the fact that we're not leading to the right health outcomes, and because we're absorbing an inordinate amount of resources, we have to stop the duplication. We have to stop this, shall we say, mandate creep. The WHO has a core mandate with 3 fundamental areas that we are seeking together to support, but not more than that. Global health initiatives, each in their area of expertise, should contribute. And all of this should be done in a coordinated fashion. Bretton Woods is a system that is no longer applicable. Yeah, which means that we will not have a fundamental, pyramid-like system where there's a clear attribution of who does what all the time. We will need to have flexible mechanisms to ensure ongoing dynamic coordination amongst all the global health actors. And that's something now, there's the discussion on the WHO front, on the global health architecture. And the main risk is that we try to recreate the universal solution to who does what. That's just not going to happen. The geopolitics are not there. So we have to be a little bit more pragmatic, because otherwise we will miss the health outcomes that we seek. So, sorry, but rebounding has its costs.
Thank you, Paco. I would really like to maintain the time that we have, at least half an hour for an open discussion with everybody, the audience, everybody who is here. So let me, before we do that, I would like to ask a final question to Dr. Karunakara, and we would be interested to hear from your point of view, where do you see Germany's greatest value and its strengths and its contribution to global health so far? Maybe you can just do an approach from where Germany came along, where we stand now, and where the future role of Germany in global health should be.
Yeah. So the great thing about Germany is its commitment in domestic space, Germany's commitment to health. Its solidarity-based commitment is one of the oldest in the world, and it is quite impressive. Even during all of the current discussions going on, rethinking health commitments, I think all parties, all political parties agree that solidarity should form the basis of Germany's commitment to its own people. But in global health, even in Germany's strategy paper, it talks about economics and security. It doesn't talk about solidarity, right? So solidarity, the idea of solidarity in health stops at the border, and outside it is economics and security. The other very strong thing about Germany is its absolute commitment to multilateralism. Right? And I think even in the discussions today, we've heard that and this is really important when others are trying to tear apart multilateralism at the moment. So Germany has stepped in, and especially with regards to WHO, Germany's work to increase assess funding, voluntary contributions, reduced earmark funding. This is all absolutely structurally, absolutely fundamental in strengthening WHO going forward. And I think Europe is also with Germany in trying to push for these sort of changes. So these are absolutely the positives I think that Germany brings. Now, on the issue of strengthening WHO, Germany has been a good faith actor. And I think world over, people recognize and nations recognize Germany's contribution. But during the pandemic, Germany was not seen as a good faith actor, right? And that has implications in how, when we talk about deglobalization in health, when we talk about countries pushing for supply chain sovereignty, health sovereignty in countries, this has a big role to play because multilateralism did not deliver during the pandemic, right? And we have to really take a hard look at why that happened. So there is a lot of thinking that we need to do in that regard. Last point that I would like to make is that we have to be careful to keep talking about health security, because security implies that we have to protect ourselves from somebody, right? So and it does not. We have to start thinking about justice and equity, right? Because if security framing, I think, is limiting in how we want to achieve, at least me, where I sit from, 30 years a humanitarian worker, I think security is a very limiting framing for global health, and we need to start thinking of justice, fairness, and equity.
Well, thank you very much. And I think that really sets a good stage for an open discussion of the remarks you made. Before we do that, I would like to give the floor to Paco and Dr. Volki for some final remarks, 1 minute each, before we open the floor. Paco, can you hold this?
Thank you very much. So, Germany's role, and this is what I will focus on exclusively. Germany, to a large extent, is seeing a little bit like the EU as a whole, as a good supporter of global health and also as a financer. But there's a big step that needs to be taken in terms of translating that support and that engagement into actual influence in the multilateral arena. And that is a homework that we're trying to do together with all our member states in order to ensure that everything that the EU system has to offer and that we can put at the service of global health is actually reflected in global health action across the board. So a little bit of homework for us together.
Thank you, Paco. Dr. Falke, your final remarks.
Yeah, so for me, I think it'll be about sustaining the efforts. I think that itself will be a challenge, and then having the scale ambition. And I really like the climate discussion, so climate justice, echoing what Uni said. So focusing on the climate justice discussions and then using that for not waiting for the future to happen to us, but happen to the future. So we happen to the future and say, what are the structures fit for purpose for the future? And then, going from where do we want to go, and then design the systems that take us there, rather than, this whole chaos that is happening right now with everybody wants to redesign the global health architecture. Thank you.
Thank you very much. And let me thank our wonderful panelists. I personally have learned a lot, and I think it was a very diverse and rich discussion that we had, and that will be a good basis for all of us to engage in a dialogue on global health and the future leadership in global health. So thank you all. We are now opening the floor. If I understand correctly, the Global Health Hub will actually pass on the microphones. Please limit your intervention to 1 minute and kindly state your name and where you're from. Thank you.
Good morning. My name is Sharbani Chakraborty from Technical University Munich. At a time when we are being asked to do more with less, this is not the first time we've heard about that, and given that next year at the UN General Assembly we will be discussing universal health coverage, I have to say I'm disappointed I have not heard the word universal health coverage at all in the last couple of days, and I throw it out to all of you for a response, because I think resilience in today's world has a lot to do with financial protection. And the second thing, your comment on NCDs. We can effectively integrate NCDs and everything else when we talk about universal health coverage. Thank you.
So thank you very much for this. I must apologize because I have actually followed the instructions. You should never follow instructions. I limited my comments to the link to the issues at hand. But if you look at the Global Health Resilience Initiative from the EU, you will see that the first fundamental factor that we say that we should focus on as we engage bilaterally with partners in this new geopolitical and financially constrained environment is to focus on the basics, UHC and primary health care, because this is the basis for absolutely everything. So I'm sorry that we didn't mention this, but please be aware that for the European Union, and as we collaborate with member states, this will be the focal point of our engagement bilaterally as we move forward. So full agreement with you. And of course, let me say this. The problem is that we're facing, I don't like to speak of multiple crises, so multiple challenges at the same time. We are facing fixing the basics to start with, and those resilience gaps, taking care of the oncoming wave of NCDs and other diseases, and then dealing with the effects of climate change, with the whole One Health, so the whole challenges in the One Health spectrum. So this is going to be particularly difficult to juggle, but we will not lose sight that the very first step is UHC and primary health care. Based, I humbly, if I can say so, the very good experience that the EU health models in our member states have delivered. They have delivered that, if anything. We have a lot to share.
We can take 2 or 3 questions and then cluster them so that everybody has a chance to intervene.
I've been handed the mic, so I should speak. Tim Shan from Global Action on Men's Health. I mean, thank you. I think there's so many things that could be talked about. I want to ask a question about this question of the pushback on women's rights and gender, and I want to congratulate this conference for focusing on gender. Part of the reason for that pushback is that men's health and women's health are seen in isolation or in opposition. And in that vacuum, you have populist movements which are stepping into that space. You have kind of cultural movements who are saying to men and to boys, we hear you, we see you, we understand your mental health challenges, we understand your social isolation concerns, your very real physical and other social issues, which in a way the gender and health community isn't really addressing, if we're honest. Analysis that we do of international conferences and otherwise, very infrequently, let's talk about NCDs. NCDs, men are far more likely to lose their lives earlier due to NCDs. And that's not about an either or. It's simply about how we think collectively. And we believe that there's actually a real opportunity to think about pushing back on those more traditional populist voices by really stepping into a space of saying gender is about everybody, as that panel was yesterday. Gender is about women's health, gender is about men's health, gender is about everyone's health. And so I guess my question to you is, how can you show leadership on that? How can the European Commission, how you mentioned the need to engage with men? Because I think otherwise what we've got is the problem becomes gender equality and feminism. We see big increases in our country, in the UK, on people saying that feminism is the cause of the problems as opposed to the real causes, which is the structural inequalities and patriarchy and the very real challenges that we have. So, yeah, can we have a kind of comprehensive conversation about men's health in a way that really enables us to embrace gender equality and to put women's rights back on the agenda?
Yes, thank you. I think I'm next. I'm Iris Hunger from the Robert Koch Institute, and thanks for this very, very rich panel. I really enjoyed it. I have 2 points and 1 question. I would like to thank Dr. Falke for pointing out the misalignment between the industry ambitions, as you called it, and the health equity. And I personally think that this is one of the things that actually hinders Germany a bit to be more effective in the global health arena, because that's just a thing that kind of like tells people that, you know, sometimes the talking and the doing in the global health diplomacy just doesn't align very well. And I think it would be one of the greatest things for Germany if we find a future-proof way to bring the economic interest and the health equity somehow together, because that would also show other Western, Northern countries how to do that. And of course, that would also require to resist to retract into national interest only. And I fear that it's not so much something that we need to do on the international scene, but that requires a lot of national discussion. So I would just like to see more on kind of like solving that internal problem. So that was my first point. Then my second point is, we heard about we have so much to offer. I think Paco, I'm sorry for using your first name, but we met before, said that. We also heard it in the room yesterday on kind of like primary health care and stuff. I sometimes feel we need a bit more humility. I think it's not so much we have to offer, but I mean, kind of like more to share experience. Offer is still this kind of like, I give something, yeah, kind of like sharing how are you doing it, how we are doing it, how would be the best way. And that's because it has a lot to do with context. And you can't just offer what you do in a context that's completely different, both financially and kind of like culturally, whatever. And my point very specifically to Dr. Falke is, we still talk sometimes about North-South, but of course we all know that it's much more complex now. And I would be interested in your kind of like experience and view how countries like China and India, where we would like to see more engagement for global health, if it's the right engagement, how it looks like from your perspective in Asia with those big Asian countries. Thank you.
And maybe one more question and then we start to answer.
I think I can make one more question. I'm Beate Kampmann. I'm the director of the Center for Global Health here at the Charité in Berlin. And I want to pick up on what Uni pointed out as the narrative. because I think it's beyond institutions at this point. It is into a societal dialogue, and the previous speaker just also alluded to that. And we need some help here, because I think we're disconnecting between us and the global health issue. And this is why I think it's so important that we realize actually global health is with us, and we are the global health community, and we're not the people who are going to provide a solution. And this is where I think the NCD question is really difficult and poignant, because we also don't have the solution to the NCD question. You said we are the people who can give that solution to other countries. I think the dynamics around that have completely changed. They're reflected in these geopolitical fractions that we're seeing, and I'm also very suspicious of this sunset narrative, because I don't think there will ever be a sunset. I think we'll always have to co-develop this space, and the climate scenario is the most poignant place also where we have to come together on that. But I think the societal dialogue around that is absolutely crucial, because this is where we're currently losing the momentum of people being willing to actually think about solidarity. And I'd be grateful for your tips on how we can move further in that narrative, which we've been trying to create also with Glora and the Center for Global Health here for a while. Thank you.
Okay, thank you very much. Tucker, do you want to respond to the pushback on women's rights and the European Commission approach? I could also add on if you were.
Yes, thanks. I will actually comment on a couple of the issues. So I think that the way that we approach it from our point of view is to look at providing objective tools and solutions for our member states in dealing with disease. To start with, you have seen, for example, you mentioned the issue of NCDs, and in some cases the disproportionate impact on men. Well, one of the core priorities of this commission, and of Commissioner Varhelyi in particular, is precisely dealing with those issues and NCDs. We're not so much tagging and talking about gender in that sense. We're just trying to fix the issue, which by definition will then address the challenges that clearly men in some cases face disproportionately, while at the same time recognizing that there are dimensions of particular need for women, for girls, for more vulnerable populations and groups. So that's the kind of balance that we want to achieve, but the objective is to provide all tools to solve the disease for everybody, every citizen in the EU, and if possible, abroad. A couple of remarks also on the very interesting comments made. And I will be very concrete. For example, on the question on NCDs, what we are having increasingly is partners from many low and middle income countries coming to us and saying, look, we are seeing the NCD issues increasingly generating problems for our internal health policy. We are interested in understanding better how you are dealing with them, because we are seeing that you have achieved a significant amount of success in tackling many of these issues. So it's not that we're trying to preach to the world. It's that the partners are coming to us for solutions. And this links into the comment that the colleague from Robert Koch Institute made. What we have here is partners are facing a competition of systems. I will not name any partners, but you know who they are. You have partners in the West, perhaps who are more, shall we say, this is the way that you have to deal with patients' data, for example, if you want our contribution to supporting health. Partners in the East, some partners in the East are saying, yes, we're going to be able to give you some support, but it's actually a loan that you will have to repay with great interest in the future for your health infrastructure. So partners are looking for what we can offer in the positive sense. Yeah, they're looking for, and let's not also underestimate what we are. We have health systems which are very well functioning, by large. We have cost-effective systems. We can be self-critical as well. We have innovative systems. We have excellent regulatory experience, and these are issues that partners are coming to ask us. How do we deal with things? Can we partner together? Yeah. So, and just one last point, and Paul will kill me, but I will say it anyway. The issue that there should be no dichotomy between the economics and the equity argument, because the key is to land on a space of mutual interest, which is precisely what we're suggesting in the Global Health Resilience Initiative. And in that space, there is plenty of opportunity for collaboration, whereas, for example, the EU's strategic autonomy and competitiveness is also not undermined, because that is a risk. But the mutual interest space is the one that we're working on, and we will continue to do so, to the benefit of all sides. Apologies.
Thank you, Paco. You're still alive. Now, I would like to give the floor to Dr. Falki and to Uni as well for the question we had from the RKI, and also on Beate's questions on the solidarity and others. So you can allude to that. But before we do this, let me just add on the issue that the colleague from the UK said on the women's rights and sexual and reproductive health and rights. I fully agree. We need men on the table. It has to be inclusive. How can we talk about sexual and reproductive rights? How can we talk about gender-based violence and many other issues, those that largely cause these issues and drive the inequities? Of course, they need to be at the table and actually tackle those. So that's well understood, and that's also in the policy framework actually integrated. So thank you very much. But now let me turn to who of you wants to go first. Uni, do you want to allude to the comments that Beate made and to the colleague of the RKA?
Sure. Yeah. No, so you can stop me when I need it. No. So first point, the lady from TU München. In 2 years, we will be marking the 50th anniversary of Alma Ata Declaration. So 50 years of primary healthcare framing, and we are still far from achieving it. And I think part of the reason is there has been, resources have not been stable. And second is that we pick and choose what we want to implement. There is no comprehensive understanding of what it is needed to make primary health care a reality. And I think that's the basis for universal health coverage, right? So that's the point that I wanted to make. Now, from the lady from Charité, I think we really need to look at narratives. I think it's a battle. That's where the battle's going to be won. Right? So, for example, we talk about all of the money that we give collectively at overseas development assistance. So then, in the public mind, we are giving so much money away. But if you look at all of the doctors and nurses working in Germany and in the UK, they've all been trained with public money in countries which have very little. So the net flow of resources is from the south to the north, not the other way around. But we don't frame it as such. And we have to stop talking about migration. We have to start thinking of mobility, because in a globalized world and in an aging world, what we know for certain is we need people to work. We need services, people who can provide services. And it's not the case that Germans will always be the ones to provide those services. So we need to start talking about mobility, not migration, and talk about resources that other countries can bring to this country. And you're absolutely right. You can't leave it to academics to frame it. It has to be a national discussion and a national narrative that needs to sort of make that framing. There was another question about RKI. What was the question? Maybe you can take it, and if I have anything to add. I forgot.
No, I also don't remember the question, but I know what I'm going to say because I made notes. so I'll take all of them in brief things. So I think can't agree more. It is health for all. So apologies if we communicated anything otherwise. Universal health coverage SDGs, obviously. In fact, we ourselves have done 2 convenings now for the post-SDG discussions. And of course, health, well-being, scaling up of UHC, PHC, of course, it emerges all the time. So apologies for that. The second second question was about the India-China and, kind of looking at the do you want to go, Uni? No. So, the north-north, south-south, north-south, whichever way you describe. So what we are seeing increasingly, and I can speak for the Southeast Asia region now, having observed it a little bit more closely, is they are owning this both the diplomatic spaces and the science spaces in the region. So you may not, kind of see those reflected so starkly at the global level, but you see a lot of movement in the regional discussions, especially with the joining up. So Southeast Asia region with Western Pacific. Even in the governance discussions, both, these countries, India and China, silently coming forward in those discussions in terms of how the restructuring should look like. So are we talking about like a regional priority? Are we talking about sub-regional priorities? Because, they themselves are such huge kind of entities. So South-South collaboration definitely coming up forward. And one other thing that I'm observing now is the alignment that we are seeing in the funders. If you see the philanthropies aligning and, declaring this 300 million that they gave now for the climate space. So you see a lot of alignment in high net individuals in these regions to fund, local kind of action on health, I would say, but again, framed from a health security side more so. My last input will be about the sunset clause. Again, probably miscommunicated. I think the sunset clause or the kind of, weaning off really is about when dependency is disguised as partnership. So I think that is the bit that we need to move away from. And there is no dispute that this is an ongoing conversation which needs to happen, bidirectional, multidirectional in terms of how things are negotiated, collective ambitions are made and actions are delivered. And of course, this also speaks to the financing, the pooled financing conversation, right? Like nobody can do this alone. No single agency, no single country, no single entity. So bringing that coherence with that joint ambition of where we want to reach, I think is something that really comes.
Just a point about sunset clauses. So if you look at all of the multi-stakeholder initiatives that we have created, like Global Fund, Gavi, etc., to some extent, it can be seen as a lack of belief in the WHO to deliver these services. These institutions were created because WHO can't do it, so let's create another institution. So there is a need to start thinking about sunsetting some of these institutions and give the responsibility back to the multilateral agency that has the mandate. But the reason they don't have the mandate, see, one thing we have to realize about the UN is only as good as its member states. If member states don't want to work together, UN won't be able to work together, WHO won't be able to work together, right? Work for all of us. So sunsetting, I think, is important, but we have to enter into it really smartly and think about, because resource crunch is real, and so we have multiplication of efforts, a lot of people doing the same thing. So there needs to be some rationalization so that our collective resources can be brought to bear in a very smart, very effective way.
Thank you very much. And also on the discussion on the sunsetting, it's very important, but let's also not forget, I mean, the job of the UN is to work themselves out of a job, right? Because that means at the end of the day that the issue is solved. But okay, we have precisely 8 minutes left. I would like to take 4 to maximum 5 questions, but please be brief, and then we'll answer them all in one go, and then we have the discussion after in the break.
Thank you very much. My name is Veronica Thiel. I'm a freelance researcher / consultant. My question is around the German view of global public health, and we've heard a lot about how it's changed over the last few years. But in general, I think, and I'm based here in Germany, I'm German too, that global public health is still seen as a very medical thing, a medical issue around infection control, about fitness to work and that sort of thing, rather than the social science it is in a lot of other countries. And I'm sure that is clear to people who work in the area, who work in the field. But how do we get it into politicians' heads in Germany outside of the health arena to broaden that approach and to what has been mentioned about before as well, to move away from Germany's biomedical model of global public health, and also to get it into broader society's minds that it is more than infection control. Thank you.
Thank you. Thank you for your insightful thoughts. My name is Adela Santos. I am postdoctoral visiting fellow at Geneva Graduate Institute. So we recently published a paper applying social network analysis within Martin Schaeffer critical transitions framework, looking for early warning signals of systemic fragmentation in global health governance. One of the findings to keep us optimistic is that there is relevant actors that could maintain the network by their bridging role. One of these is, of course, Germany. It means all the connections Germany has at this time. It's capable to maintain the network and be a relevant actor. So at the same time, its participant coefficient suggests a certain thematic concentration. I am still trying to understand if that reflects a strategic choice or a specialization, or maybe due to a structural constraint. So if it's a specialized decision, could it change to face the new challenge in global health governance and in the new era of multilateralism? That's going to be my question. Thank you.
Andreas Wolf from Medico International. Just two short thoughts about one on the health sovereignty discussion. I think I'm a bit cautious because when we hear health sovereignty in Germany, it is mostly by our right radical populist party who is always trying to defend the German interest against a multinational, multilateral system like WHO, who is dictating on how you deal with epidemics. So I think the problem of sovereignty is definitely that countries are not having enough resources to do their own public health. But of course, it is also has to be balanced according to a solidarity dealing together with global problems. And the second comment I would like to make on as much important as it is to strengthen the multilateral system. Don't forget that multilateral system is basically an interstate system where the voices of the people, the voices of concerned communities are often very much neglected. And this was also part why certain initiatives like UNAIDS were created. And speaking about sunsetting is something, but another thing is to dismiss the experiences in how modernizing global health governance should be also keep into mind their experiences and how it is possible to really reach beyond interstate action and the multilateralism system, and also integrate the voices of the people that are concerned with this. Thank you.
Many thanks indeed. Arash Rashidian from WHO. So I'm very grateful for the rich discussion and insight. So we know that even in countries that rely on international support for their health program, in a very large extent, the maximum, the majority of the money spent in the country is actually from the country itself. So the main part is the national resources in the end. When those international support is dictating certain direction, they resolve some of the problems, but they cause other problems by diverting resources. When they leave, they generate vacuum, they result in brain drain, etc. What I want to highlight is that the way that Germany has been supporting countries, and I say that based on my experience for over 10 years in WHO, and before that analyzing health policies in countries, again, for a very long period of time, has not been like that. So responding to that, so GIZ support in countries I've seen engaged has been very much respected on responding to the national policies, responding to the needs, listening to the priorities. And the money that Germany also has supported WHO has been in a way that had addressed areas that were really needed to be done. The way goes for some other EU countries, for example, Norway approach for supporting. So I say that as a WHO colleague and also as a sort of health policy expert, I wish Germany doesn't change the approach. Obviously, more resources is good, but the approach has been effective and something that I wish more partners do that in addition to Germany. Thank you.
Thank you very much. I think we have one more question and then we need to close, unfortunately. So one more.
Anna Grigorian, Armenia. Thank you for wonderful panel discussion, and you touch base on so many issues that shows the complexity of global health and governance. Just a brief 2 comments. When you were talking about collaboration, mutual interest, and how we could have win-win, it came to my mind that like genomic sequencing collaboration worldwide could be a good example of global health collaboration. When Japan does their research in the morning, the night results are there, and US doesn't need to repeat it, they use that results. And the same done in France and Germany. I think global health could use that good example to address the issues, because we touch on climate change, NCD, there are special pathogens, outbreaks in Africa, there are wars in 2 or 3 continents, active wars for several years, which means mental health is there. I think the needs are great, the funding will never be enough, and you touch base on industry and non-traditional donors, which could be also scanned and brought to the picture. But what the second comment I would like to do and basically build on the colleague that just mentioned about humble communication. I think humble leadership in global health and empathetic leadership, this is what we need for future collaboration. Thank you.
Thank you very much. And let me very briefly try to take a stab at all these questions to summarize those and then give the floor to our panelists before we close. Now, on the fragmentation in global health, the Graduate Institute in Geneva asked you posed this question, right? Exactly. Now, yes, Germany has obviously a bridging role, and it's also very clear that the fragmentation that was built over the last decades, of course, now will naturally come down and condense by the sheer absence of resources we have, right? I'm personally skeptical that we have this process. It's good that we have this process on the global health architecture and its evolvement at the WHO, but I'm very skeptical that we have the time and can afford a very lengthy process now, as we see it, for instance, with the pandemic agreement. We simply do not have the time for that. So my hope is that we really come to clear and very quick terms to the benefit of the global health architecture and to the benefit of those who need it most. So that is something, as an effort that we need to do as a global community, but also as member states. We cannot afford to fiddle around too long and have this process over years and years and years, while at the same time people are actually dying and suffering. So I think that is, we need to put some traction on that. So that's why I was initially skeptical of having an intergovernmental process where it stands. Now on the health sovereignty issue that you mentioned, I don't think it's a narrative from the far right. Health sovereignty is an issue that we all need to tackle together, and we must by all means avoid that this is hijacked by the far right. So I think that's our task. But health sovereignty in itself has a positive connotation, and everybody wants it, and we need it, and we cannot let it happen that the far right is actually trying to undermine it and use it and give it a different spin, so that it's actually something that works against multilateral structures. So I think that's where we need to be very vigilant. Now, on the last question, WHO, on the financing and the framing you mentioned, and ultimately you said it's about earmarking of funds, right? Yes, Germany is a big donor to the WHO and will remain one of the major donors. Germany is trying to the best extent possible to not earmark funds and for specific projects, because we know what it means. We know that this has a multitude of complications at the international level and also for the organizations, so we try to not earmark it. That being said, in the absence of funds, we need to maintain critical structures, such as, for instance, the WHO hub here in Berlin. We, of course, cannot exclude that a certain amount of funding is actually tied to financing of certain parts of WHO. But the overarching principle is that we do not want to earmark funds for non-international organizations, because you know better what to do with the money than we do. Thank you. So I would like to very briefly give the floor to the panelists, and then we close. Any final remarks?
The first point about the training. I think two initiatives that I can give an example where we have tried to navigate the clinical, dominance in public health spaces, working with the Ministry of Higher Education, working with the Ministry of Health, and working with the Ministry of Foreign Affairs. So we are now launching a master program in science diplomacy with a focus on climate diplomacy and health diplomacy. So, kind of owning that space a little bit more again. And then the second thing that we are doing is also practice-oriented training programs. So I'm on my way to Mozambique now. We're launching a School of Public Health there with a Master in Public Health with a practice orientation embedded in the National School of Public Health and focusing on the Lusophone countries, 5 Lusophone countries. So there are initiatives, which kind of navigate that space. And one last point, I would say, which we did not discuss as much as I would have liked to, is the pace at which technology is advancing, and how we are going to then navigate all of these discussions, in terms of catching up, and also the governance that is needed for how it will then shape the discussions for us. Thank you.
Thank you very much to all the fantastic panelists. I learned a lot. Oh, one final remark. 1 minute, please.
I just want to underline there's a lot Germany can do. If you look at the golden age of multilateralism, at least in the time that we've been alive, between the fall of the wall here and between 9/11, middle powers came together to talk about human security, of which health security is a part, to talk about responsibility to protect, etc., after Rwanda and what happened in the Balkans. So middle powers can do a lot. And Germany, in its position, can be a driver for a lot of these discussions going forward and creating sort of a vision and also the instruments for which we can all achieve, what we want to achieve in global health. But it starts with coherence at home. The ministries have to work together, right? And that, I think, is, so anything you want to achieve abroad, you have to start working together here in Berlin.
Thank you, everybody. Thank you to a fantastic panel. I learned a lot. I think it was a great discussion, a very insightful discussion, and also a lot of food for thought that we can take actually the dialogue in the lunch break further. I'd like to thank the audience for the great questions, for your participation, and of course the Global Health Hub Germany as our most trusted partner to organize these kind of events. Thank you very much.